Welcome back to Firemite Coding. This is part 2 of our breakdown of the number and complexity of problems addressed, the section that sits right under the second column of the MDM table in your CPT book. If you haven't seen part 1 yet, go watch that first because it sets the foundation for everything we're covering today. Now we're picking up with the moderate to high level problems addressed with clear definitions and simple examples, so you can understand how each one affects MDM levels.
And I'm ready. CPT book out, coffee out, let's keep it going.
We'll start with the moderate level. A chronic illness with exacerbation, progression, or side effects of treatment is when the patient has a long-term condition that is worsening, flaring up, or when they are experiencing problems that's caused by their treatment or medications, and the provider must take action to manage it. It is not stable, not new, requires evaluation or treatment adjustments. Let's say an established patient with moderate asthma comes in because they're wheezing more, using their inhaler daily, and feeling short of breath with light activity. The physician performs a physical exam and orders a breathing test. Then they determine the patient is having an acute exacerbation. The provider may decide to increase the inhaler dosage and prescribe a short course of oral steroids to break the exacerbation.
So basically, the illness been there, but today it's showing out.
Exactly. The provider made new assessments, ordered and reviewed tests, and managed prescriptions. Undiagnosed new problem with uncertain prognosis is a new health condition where the provider has not yet established a definitive diagnosis, and there is a certain concern that if not addressed promptly, it could result in high morbidity or significant health consequences. It is a new issue, potentially a serious condition, uncertain, and the provider documents with terms such as uncertain, cannot rule out, evaluate for, needs further workup. Let's say a 42-year-old patient comes to the office with new concerning symptoms that have developed over the past 4 months. They complain of fatigue and unintentional weight loss of 15 pounds with no lifestyle changes. The physician performs a history and physical exam. The physician suspects a potentially serious underlying condition such as a malignancy or a severe autoimmune disease. The physician may order extensive lab work, x-rays, ultrasounds to rule out conditions. The provider discusses the differential diagnosis with the patient, informs the patient that while the cause is unknown, serious conditions must be ruled out. A follow-up appointment is scheduled to review the test results.
So, we don't know what it is, but we're going to find out.
Right. It is a new problem with an unclear cause, so the provider has to investigate. Acute illness with systemic symptoms is a new, short-term health condition where the symptoms are not localized to a single organ system but affects the whole body. The condition has a moderate risk of morbidity without treatment. Examples include fever, chills, fatigue, and body aches. There's risk of the condition worsening. Let's say a 27-year-old female presents to the urgent care clinic with a 3-day history of sharp pain in her lower back, a high fever, nausea, and body chills. She stated she had a urinary tract infection that has now gotten worse. The physician performs a physical exam. A urinalysis is performed in the office, which shows high levels of white blood cells and bacteria, which confirms a severe infection. A urine culture is ordered to identify the specific bacteria and determine the correct antibiotic to use. The physician diagnoses acute pyelonephritis and prescribes antibiotics and acetaminophen.
Oh, so when your whole body is clocking out, not just your, down there part.
Exactly. When the condition causes whole body symptoms, the MDM level changes. Acute complicated injury requires treatment that includes an evaluation of body systems that are not directly part of the injured organ. The injury is extensive or it involves multiple treatment options with a high risk of serious complications. Let's say a 50-year-old construction worker is brought to the emergency department due to a fall and sustains an open fracture of his right ankle with debris and dirt contamination.
For those who didn't know, open fracture means the bone breaks through the skin.
The physician performs a comprehensive evaluation, orders x-rays, and consults with an orthopedic surgeon. The patient is immediately taken for a surgical procedure to debride the wound to prevent infection.
And debride means to thoroughly clean out the wound.
Great job, Rookie Rhonda. The physician must evaluate the patient's cardiovascular and neurological status in the foot and leg to ensure proper blood flow and nerve functioning. The fracture is surgically reduced, stabilized with internal or external fixations, and an IV antibiotics are given. Then the patient is admitted to the hospital for observation and post-op monitoring.
Oh, so this is not the simple little injury. These injuries you have to think about infections and fractures and concussions, nerve damages, and other risks?
You got it, Rookie Rhonda. There are multiple treatment options. Injury is extensive, and the treatment options also carry a higher risk of morbidity than a simple sprain or closed fracture. Chronic illness with severe exacerbation, progression, or side effects of treatment is a long-term condition that is dangerously worsening, flaring up, or when they are experiencing serious problems that's caused by their treatment or medications. The provider must take urgent or intensive action to manage it. It is to the point that it possesses a significant threat to life or bodily function if no intervention. It is not a new condition, rapid deterioration, and a risk to life or major body function. Let's say a 42-year-old patient with a history of Crohn's disease presents to the emergency department with 3 days of worsening abdominal pain, fever, vomiting, and no bowel movement in many days. Patient takes an oral medication to manage Crohn's disease. The physician performs a thorough physical exam, orders lab tests, and CT scans of the abdomen and the pelvis area. They confirm the obstruction. The patient is admitted to the hospital. The patient is given IV fluids and antibiotics. The physician consults with the surgeon to relieve the obstruction and repair and manage the high risk associated, such as possible sepsis and bowel rupture. Then surgery is initiated.
Okay, I think I got it now. Since their chronic illness is severe and has gotten worse, it's now a high MDM.
Correct. When a chronic illness severely exacerbates or flares up, or serious treatment side effects take place, the condition is much more dangerous, therefore it becomes a high MDM. Acute or chronic illness or injury that poses a threat to life or body function, it is an acute or chronic illness or injury or problems that's caused by side effects of treatment that are life-threatening. It could become life-threatening very quickly or could cause major permanent harm if not treated immediately. It is urgent and has critical decision making. Let's say a 65-year-old male patient with a history of high cholesterol and smoking cigarettes presents to the emergency department with severe chest pain radiating to his left arm. He has shortness of breath and sweating. The physician immediately obtains an EKG, which shows an ST elevation.
Isn't this a clear sign of a heart attack?
That's right, Rookie Rhonda. The physician orders immediate lab tests and consults with the cardiology team for an emergency cardiac catheterization to restore the blood flow back to the heart. From there, aspirin, anticoagulants, and other medications are administered. The patient is admitted to ICU or intensive care unit for continuous monitoring. Physician discusses the condition and the urgent need for intervention with the patient and their family.
So this is the one where the provider's making life or death decisions. Okay, got it.
Exactly. When an illness or injury threatens life or essential body functions, the provider has to act fast, and that makes it a high complexity MDM. All right, that's the end of part 2 of the number and complexity of problems addressed at the encounter. In part 3, we're moving to the third column of the MDM table, which is the amount and or complexity of data to be reviewed and analyzed. This is where we break down labs, imaging, tests, records, and everything the provider reviews.
Oh yes, because that column has been stressing me out too. Labs, notes, imaging, like how many things do we gotta count?
I understand, Rookie Rhonda. So make sure you subscribe and turn on those notifications so that you do not miss part 3 when it drops.